Hello, I'm Dr. Jeff Kazaglis, and I'm one of the orthopedic surgeons with OrthoIllinois. Shoulder impingement is a condition where the rotator cuff becomes inflamed. It can become inflamed due to disease within the rotator cuff tendon itself, or it can become inflamed because of external pressures on it, such as inflammation by the rotator cuff or a bone spur. There's actually 4 rotator cuff muscles. One is in the front, called the subscapularis. There's actually 2 muscles in the back that come together, the one on top being the infraspinatus, and the one on the bottom being the teres minor. The one on top here is the most commonly injured or damaged one, called the supraspinatus. And right next to that is actually our biceps tendon. Sometimes what can happen is our bone in the top of our shoulder can become inflamed and develop a spur that comes off the front of it. This bone in top is called the acromion. If you lift your arm overhead, the rotator cuff muscle can get pinched by the acromion bone. If you've developed a bone spur or inflammation in that area, that can be a common source of pain. One common test involves the provider lifting the arm overhead. When that is done, if the rotator cuff is inflamed, it can cause a lot of pain. Another common test is where we bring the arm up to about shoulder level and then we rotate the hand down. By doing that, we're bringing the rotator cuff and the shoulder muscles closer together with the bone and tissues on the top of the shoulder. If those structures are inflamed, it'll immediately cause pain. Conservative treatment involves physical therapy, sometimes a prescription anti-inflammatories, and even an injection of steroids into the shoulder. Physical therapy has 2 goals, one of which is to restore the range of motion of your shoulder, and the second is to improve the strength. In addition, if the shoulder is inflamed, it helps to prescribe some anti-inflammatories. Sometimes we'll have patients take over-the-counter medicine, such as Aleve or ibuprofen. Other times, if we feel it's necessary, we'll prescribe something prescription strength. If those medications and the therapy fail to work, sometimes I'll consider an injection of steroids into the shoulder. Sometimes if conservative measures, such as the therapy, the anti-inflammatories, and the injection fail to relieve your symptoms, at that situation, sometimes we'll talk about surgery. The surgery involves 3 steps. Number 1, we make a series of small incisions in your shoulder, and we put an arthroscope, which is a device that lets us look around and see any structures are damaged. The second step of surgery is to look at the rotator cuff. If the rotator cuff has been damaged or inflamed, sometimes we'll trim off the inflamed part, or sometimes it's required to repair it. The final thing we do is remove the sources of inflammation in the shoulder. Sometimes that involves shaving down a bone spur. So if my finger is the top of the shoulder, sometimes people have a bone spur in the front of it. And what we do is we go in there arthroscopically and shave that flat until there is no bone spur pushing down on the rotator cuff. Sometimes there's connective tissue around the shoulder called the bursa that can become inflamed, and sometimes we also remove that.